Hi, I'm Kathryn Balaram. I'm a nurse and I work for the American College of Culinary Medicine. Culinary medicine means a whole person approach to healthcare, which aligns really well with the philosophy of nursing. We are all about the whole person. And if you think about it, we talk about, like, for instance, medication adherence with patients, but food is related to so many chronic diseases, and food is what we have, at least 3 times a day, if not more. And we need to be talking about this to our patients in a way that is accessible and that they can apply to their own life. Oh, most definitely. I think I probably wouldn't have gotten hired unless I was CCMS. But it has, I've learned so much from the program. And what I really appreciate is that it's very much evidence-based, which is hard in these days of, when you're constantly bombarded with media and patients that are taking all of that in. You can then be assured that the information that we've gained from the CCMS curriculum is all vetted and evidence-based, and we can provide that sound knowledge to the patient. And not only knowledge, but how to apply that in their own life, and to apply it in a way that is meaningful to the patient, that, we use like motivational interviewing techniques, and so you elicit and empower the patient to apply it in ways that, it's not perfect, but it's going to work for them, and that's, what we're aiming for over the long haul of the lifespan. I feel like, as someone that provides most of the meals for my own family, it allowed me to tweak things in ways that made it a little bit healthier, and time hacks. When you're busy, have young children and stuff, life is a little more complicated. And so learning those time hacks to like batch cook and make things ahead of time and get that into your routine helped me. And when I do it, it's easier to help patients, because we've all kind of we've been there, we've done that, we can tell the lived experience, which I think is helpful for our patients and is more relatable. Oh, I would tell them, do it now, don't even think twice, because this is so impactful. Like I said, food is what we eat all the time, and I feel like it has been a missing component of the healthcare that we provide for our patients, but such a pivotal, important one, that you can get instant, like a patient can feel better in a very short time span by just tweaking little things in their diet, to make their food more nourishing and not just grab for those chips or something that may satisfy them in the moment, but then they feel just kind of like, not very energetic afterwards. So just really fueling the body with food that nourishes and helps them get them throughout their day. We go slide by slide, updating, looking at the articles, where the information is coming from. We dig into PubMed and look for the latest articles, and we use the hierarchy of research, so like your meta-analysis, systematic reviews, your interventional studies, of course, are the more reputable ones, although a lot of nutrition sciences and epidemiological studies. But we do not cherry pick, we just look and see what the body of evidence is showing, and we update each individual slide that relates to whatever facet of nutrition. And then we try to make it more engaging and more applicable ways to apply this knowledge, and with using culinary techniques, for instance, like if cancer treatment, if the sensory issues are off, well, let's look at flavor balancing and how we can teach patients to rebalance their flavors in ways that are changing because of their treatment, for example. Ooh, I have so many favorites. It's hard to narrow down to one. I mean, I do have a sweet tooth, so I love like the New York Times plum torte or a good banana cream pie where I add a little bit of like cream cheese, a third less fat cream cheese to give it a little tang and offset the sweetness. But for my chapter in life right now, my go-to favorite recipe is actually from the Health Meets Food. It's the Creole seasoned chickpeas. And it's just something so quick and easy to put together. And I use it for my breakfast. I put it in alongside my avocado toast and adds that kind of protein and fiber and just kind of keeps me satiated a little longer. And then I can have it as a quick snack. And even the kids will eat it sometimes. So that's always an extra bonus. But it's quick and easy, which is my chapter of life right now.